To give us an inspirational lesson. Thank you.
Assalamu alaikum. Hello everyone. I would like to warmly welcome you to this very important event. Thank you for taking the time to be here today. We are gathering to raise awareness about breast cancer and support those who are affected. Breast cancer is one of the most common cancer among women. You represent how much we care about education, prevention, and helping each other. The aim of this event is to encourage regular checkups and to educate everyone about the prevention. Together we can make a difference. Thank you.
Participated in our breast cancer awareness campaign. So our theme for today, for this year, is empowering women, spreading knowledge, and strengthening community. Since we are a group of women, a diversified women from 12 countries, so we know that this breast cancer is really a problem for women. It is one of the most challenging journeys as a woman may face in her lifetime. And 1 in 8 women will experience it. We can prevent breast cancer. However, we are supporting them through awareness campaign like this by wearing pink ribbon that I do not have. I forget to put. The color pink, it evokes traditional feminine gender roles, caring for other people to build. This represents the courage to fight breast cancer, hope for the future. We as community leaders, it is important for us to look after ourselves first before looking out for others. For us to have a quality and safety environment when women come together, we are stronger. So make sure to screen every 3 years if you are between 45 and 69 years old. I will share the number that you can set an appointment in our PHCC. You may dial 800-112 to book your appointment for breast screening. So this is for us to know if we are still safe. This is very important for us as a women. Thank you, and thank you all for coming.
We have the representative here. Ms. Queen Antoinette, please come over to receive this. Who is going to present it to her? Ms. Elu, please.
Yeah, it's better.
Please wait on this one. And the next award is for Asian Medical Center, Well Beyond Care. The representative is here. Asian Medical Center. Dr. Obira. Is she coming? Yeah. Thank you so much for your support. Federation of Indian Nurses Qatar be getting ready. The next award is for you. Miss Mary from the Federation of Indian Nurses. The next award is going to and we have one final award for the
Appreciation to Workers Support and Insurance Fund in recognition of your unwavering support and dedication to programs that uplift and empower the expatriate and workers communities in Qatar. Your effort have inspired and uplifted their spirit while also providing mechanisms that safeguard their rights and their welfares. Presented on October 18, 2024 in Doha, State of Qatar. It's been our honor to Maggie. May we call on Maggie, please? Maggie. Salina from Bangladesh, please come also join.
please. Before that, let me introduce few things. Why we are having this awareness every October. See, the awareness program started since 1985, and from 1990 onwards, the decline of the incidence of breast cancer. So there is a lot of influence of this awareness program in bringing down the incidence of breast cancer. Still now, we have almost 2.3 million new cases every year. And certain facts regarding the breast cancer is most of the cases, the identifiable risk factor may be just being a woman or an advancing age. In 70% of the cases, we cannot identify any risk factors. Also, few cases are identified as genetic predisposition, that is almost less than 5% of the cases. And certain other factors are the survival rate of the breast cancer, if identified earlier, is much more, it's almost nearly 99% now with advanced treatment. When it is diagnosed at a very early stage, like an isolated lump without any spread. But if it starts spreading, the cancer, the survival rate gradually declines to almost less than 70%. To almost less than 70%. And another fact is that, in 40% of the cases of diagnosed breast cancer, the woman usually presents with a lump. When the woman presents with a lump, only it is being diagnosed. So all these show towards regarding the importance of the awareness of the breast cancer, and also the importance of the self-breast examination and the regular screening, and also approach to the medical facility at the earliest. Now, I am here not to scare you, just to make you aware of yourself. Now, what is cancer? Actually, it is the uncontrollable abnormal replication of cells which produces cancer. Normally, for any individual, regularly there is a multiplication of cells in the body. And the first, you can see in the normal cell division, you can see a green color cell. That is an abnormal cell. If our host, if the body immunity or the health status is good, usually this cell will die by itself by a process called apoptosis. That is a natural defense mechanism of the body. But if any factors is favorable for its proliferation or replication, it will just go ahead with continuous replication of the cells, finally resulting in cancer. Now, what is breast cancer? It's a tumor arising from the cells of the breast, and it is the second most common cancer, and also it is the second most common cause of death among the cancer of women. From where does it arise? The breast tissue, there is a glandular tissue which secretes the milk, and there is a ductal system which drains the milk to the nipple. So, the cancer can arise either from the lobules or from the duct which is draining the milk. Mostly we see, the commonest is ductal carcinoma, and actually that presents little late with the lump. And what are lymph nodes? We always, you have heard of the lymph nodes. The lymph nodes are small organs in the body which will drain a foreign body. So the abnormal cells will be just drained at the lymph node. That's why the lymph nodes become enlarged in a case of breast cancer. And then the cancer can spread. As the circulatory system is cancer, but the incidence is very less when compared to the woman. When 135 to 138 woman is affected with breast cancer, one male is having affected. Now what are the risk factors? See, the risk factors can be classified into two. That is, one is uncontrollable and which is controllable. Uncontrollable are the risk factors, it is the family history, we don't have any control over it. Our relatives or close siblings or maternal or paternal relatives, if having any cancer, then again the risk increases. Also, genetic predisposition. See, the high risk woman can have a screening with the breast cancer antigen gene, that is a BRCA1 or BRCA2. And another thing is that previous history of radiation to the chest wall for any other kind of malignancy. Then early menarche and late menopause. Again, the age of menarche is again, it's not under our control, and also like menopause. Again, the controllable risk factors are, one is obesity. Also, the older age at first live birth, or when a woman has first delivery at a later age, the risk for breast cancer increases. Nowadays, the problem is the women are getting more education. They are finally with their degrees, then their career, all finally getting married little late, and again first pregnancy comes at a later age, again which predisposes to a risk for breast cancer. Another thing is that again alcohol consumption. They should minimize the alcohol consumption, and they should not, or even if at all, very minimal. And then breastfeeding. Breastfeeding, it is not written here. Breastfeeding. A woman who breastfeeds the baby for long, the risk will be reduced. In this context, I would like to say one thing. I told you about the BRCA1 and BRCA2 genes. So the women who are at high risk, if they have the screening in Western countries and all, even they advise regarding a prophylactic mastectomy. Once a family is completed, they can undergo a prophylactic mastectomy to prevent it from developing. Now, when we talk about the breast cancer, mostly the breast cancer occurs at advancing age, or the incidence increases after 50 years, even though young girls are also being affected, and they should also be aware of this and should take part in the self-breast examination. Now, screening any of breast cancer. You should be aware of such a situation, and you should be regularly doing the screening. A breast self-examination is that which a woman does at home, and a detailed demonstration will be one of the next speaker. When to do the self-breast examination. So the menstruating woman should do the self-examination about 1 week after the period is over, because during the period the breast is very much congested and maybe tender also. So if you do the examination 1 week after. So the test to be repeated every month, and also a woman who is menopause should do the examination. They have to fix a day, like first or 10th or 15th, like that, convenient for her, and should do every month the same day. Now, what to look for? You can see a pain, you can see a lump. It may be painless, it seems like a projection, or it can present like changes in the breast size or shape. Next is, you can see that the nipple is retracted, an inward drawing of the nipple. Or it can be an abnormal discharge from the nipple. Needn't be always bloodstained discharge. Even a watery discharge from the nipple, I have seen malignancy. Many a time, the woman just a watery discharge came, and everything was normal. On palpation also nothing was there, but still asked for an ultrasound, but then diagnosed with this ductal carcinoma. Also, you can look for the changes in the texture. You can see the skin, whether it is irregular, whether there is any puckering, whether there is any drawing of the skin, or like the edema of the skin. We call that a fluid retention which produces like an orange peel appearance. Also, breast pain. Needn't be always without pain. A breast pain also can be a sign of a symptom of breast cancer. Now, breast self-examination, it should be done in 3 postures. Actually, every woman, they should expose themselves in the front of the mirror and should have an idea of our own breast. Because normally, as the difference in both the eyes, the breast also will not be symmetrical. So that asymmetry, which is normal for that person, should be known by her in the beginning itself, so that they'll be able to notice any difference in the further ongoing examination. So the inspection just in front of the mirror is very important, and that should be done in 3 postures, like the arms by the side, and also the hip on the arms on the hip, and also by raising the arms above the head. And I think details she will say. Again, the examination by palpation is very easy when it is done under a shower, because the water, and with a mild soap, you can very easily palpate any irregularities in the breast tissue, and it will be comfortable also. And also, you have to do the same thing on the other side. And next should have an examination in the lying down posture by circular motions. Details next is becoming now will tell you. And finally look for the any discharge. The rare signs to be aware of. You needn't be always present with a lump or retraction or a discharge. You can see as a red patch over the breast. And I have seen a case which was very bad. The woman had some reddish pigmentation over the breast, and she was thinking it as some infection of the skin. Over the counter bought some medicine cream and applying since many years, and finally it was keeping on. It was kept on spreading, and she has come. And then it was an inflammatory carcinoma. It's a condition called inflammatory carcinoma where patchy color, red color, patches over the breast. And some areas you could see that purely orange appearance. Purely orange means the orange peel-like appearance, like this. Now what is mammogram? Actually the mammogram, it is taken, the breast tissue is just pressed between 2 plates, and then it is cleaned. And the first you can see is normal, nothing is seen in that picture. Second, you can see well circumscribed lesion, and that is not cancer, it is a benign cyst. And the other you can see it is very irregular, and so it is easily picked up. Before palpating before a lump is being palpated, a mammogram can detect a breast cancer. Now when to screen? From 20 to 40 years, every 3 years, they should have a screening. And after 40 years, it should be done annually. and also to be supported with a mammogram after 35 years. And suppose a woman is high risk for the breast cancer, like the family history or the BRC gene or any other factors, then they should have additional an MRI also. Now, what are the myths? There are certain myths like only women with a family history of breast cancer will have cancer. No, most of the cases we don't identify any family history. And
Yes? Anybody, please? No. Women. Now it's increasing. The breast cancer is increasing, right? So 1 in 8 women worldwide. 1 in 8 women. My sound is too much. Crying to the doctor, can you save my mother? But no chance. This is the one thing. Another experience with my colleague, I will tell you. She was sitting in the hospital and she was entering something in the computer. You know the necklace, chain? She was just moving the locket like this. She was just moving. It dropped down and she was feeling something is there in the chest. Something is there. She had a friend because she had a family history. She directly went to the hospital and that was the first stage. See how it has been saved. So this is the thing what we have to do. Be aware. Check yourself. See how much time you are spending for yourself. Anybody? Mothers? No time. Why? Even me also. I am telling you, we don't have time. We are working mother, working. And then coming back home, kitchen work, homework for kids. Thank God we have to take care of the husband. But we don't have time to take care of ourselves. No. We have to take care of ourselves. Okay, that is the main thing. Just 2 minutes, 5 minutes. Just go to the washroom before bathroom. Like, go to the washroom before bath. Just check. What do you have to do? How you will check? How you will check? Dr. Meera have explained very clearly, right? Standing in front of the mirror. Yes. Then you will see your beauty. Naked. True. What does she said is true. Naked. Well, lift your hands. Lift your hands like this. Okay. Then see the normal shape of your breast. Normal shape of your breast. It will be normal. Okay. Now, Dr. Meera told check every month after 7 to 10 days of menstrual cycle, right? Yes. Because there will be some tenderness while this menstrual cycle, right? You will have some pain and all. So to avoid that, they say after 7 to 10 days of the menstrual cycle, then what you will do? Move your hand. Move your hand. Why you have to move your hand? To know the shape of the breast. The two breasts will be not the same shape, but there will be no abnormality. It will go normally. But if it is abnormal, there will be some star or like hardness, okay? Then what you have to do? Lift your one hand, with your right hand, go clockwise. With the 3 fingers, don't press. If you press, what will happen? There is already tissue in our breast. You will feel, oh my God, there is a lump. And you will run and say, oh my God, I have cancer. No. You have to press with the 3 fingers. And then go clockwise. Okay? And also in the axilla. Okay. So, one more thing she told is mammogram. I will come back with the self-breast examination. Mammogram. Because I just explained about the lump. You know the grapes, right? Grapes? Ladies, are you hearing me? At the back? Yeah. So, you know the shape of the grapes, right? Maybe you can feel like a shape of a grape. But if you go for a mammogram, when it is a nut shape, small shape, it can be seen, right, doctor? Yes. So, when at the 40s, about the 40s, you have to go for a mammogram and it will be early diagnosed.
Okay, then let's come back to self-trust examination. Are you here? Press the nipple and we will see whether there is oozing and if there is any bloody discharge. Okay, this is very dangerous. Okay, and also you will see whether is there any redness or not, or any rashes, and also any skin is going inside. Okay, dimpling it is. So you have to check whether this abnormality is there. 1 month you check, it's finished, I'm normal. No, you're not normal. You have to check again the next month. Okay, so this should be done every month. Okay, this can keep your breast healthy. It's not good to do mastectomy, right? Right? Yes. So this should be prevented. Our breast should be prevented. And I will tell you, if you find abnormality, don't be afraid. Okay, don't be panic. Be brave. We have to defeat it, right? Yes, we have to defeat it. If it comes, we have to face it. So go directly to the health professionals. Don't say to your friends, oh my God, I have cancer. It's not cancer, it's just an abnormality. No, that's not right. You have to go to the doctor because you have to get confirmed whether do you have a problem or not. Yes? Yes? That's right.
Yes.
Bye-bye. Oh, please, this is very important. Sorry, huh? Sorry. I'll just pick it up. Okay. So please be aware. This is very important. I'm not joking. This you can go to your family. You can go to anywhere and just say, oh my God, that sister have told, yeah, I have to check. Mama, can you please check? Yes. You can say to your family. You can go and say to your sister. You can say to your aunt. You can say to your friends who are even not under this profession. Yes or no? So there is more, and whoever mothers are breastfeeding or the pregnant ladies have to breastfeed. That is very important. Breastfeeding is very important. And also there is some risk factors which I have heard from the doctors. I don't know whether it is right or not. Like early first childbirth. Is it red risk, ma'am? Medical team lead. Thank you, Chichi. So I will just demonstrate how to do. So think you are standing in front of the mirror and with the 3 fingers, as I told, 3 fingers, okay? With the 3 fingers you will do clockwise. Don't take your hands out. Why you should not take your hands out and you will go to the next place? Because you will miss the place, right? So for that you will go in a rotatory motion where you will not take the hands, okay? So you will go like this, checking. Okay, see, you can see a rash. Actually, if your paw is on the left side, you can come and see. Okay, there is some rashes here. Oh my God, there is some rashes. I have to see the doctor, right? You have to see. So here you can see inverted nipple. That is a normal nipple. It will be inverted. It will go inside. So that is also an abnormality. But there is normal also flat nipples. Don't be confused, please. Yeah, sister? Yes. Yeah. So you have to go in a rotatory motion with the 3 fingers. Then you have to check the axilla. Axilla also you can go in a rotatory motion. So you can feel a lump. Actually in this mannequin you can feel a lump. So you can just come and practice on it. Okay. Then see, you can see the oozing of blood. Okay. And the crack. This one, areola also. So just, this is what you have to examine. First thing, you have to lift your hands. Then only you will understand the shape of the breast. You have to lift your hands like this. And then you have to go on the rotatory motion. Okay? Thank you so much. And thank you for...
And spread advocacy among expatriate women. This event, held on October 18, 2024 at Aspire Ladies Sports Hall in Doha, Qatar, would not have achieved its purpose without our commitment and effort. So we will call the names. Please come forward if you heard your name called.
Thank you, Max. So may I invite Miss Mary Joseph Ayeni? I'm sorry, please come over.
Wonderful maid.
Yeah, I'm beautiful and wonderful man.
Can you repeat that?
I'm beautiful and wonderful man.
Can you say like you mean it?
I'm beautiful and wonderful man.
Wonderful. I'm Margaret. Please sit down.
Thank you.
Okay, first, I have to say I'm so proud, because my friendship list is growing big day after day. My fellow women, leaders, friends, and distinguished guests, I would like to express our deepest as women community leader in Qatar. We would like to appreciate our beautiful sister, mother, and a friend, Miss Kulud. We really appreciate you for bringing us together again. I would like also to appreciate Philippine Institute, Asian Medical Center, and East Optic for the good work you guys are doing. As we reach to the end of today's program and pure to the focus of today's event, I have learned that speaking is the key and the most important skill. When I say to get help, most of people don't like going to the hospital, but you can start from speaking to the person next to you. That could be your colleague, your sister, your mom, your partner, or even a stranger. Trust me, strangers are the most helpful people in this world. Personally, I feel safe and happy saying something to a stranger or asking something to a stranger. So remember, speaking out will be the first help, and the first help starts from you. We also learned that we maintain good health routine, eat healthy, because healthy is very important to each and every one of us. Once again, congratulations to each and every one of you for attending this event. This event could not be this colorful without you, so appreciate yourself. One thing I have a message for our sister, our friend. Again, I learned that people will forget what you say, people will forget what you did, but people will never forget what you made them feel. Max and other leaders, I appreciate you, and let's grow together. Let's support our leaders wherever they are. And to all women, my message to you is, let's be women for women. Women will support each other. What I believe personally, a happy nation needs a happy woman, and that is us. A happy world needs a happy woman, and that woman is you and I have another message. Self-love. Self-love is very important. Self-love is the best and the first key for you to grow step by step. What I believe, if you don't love yourself, how can you love someone else? Women, we are the world. Without women, there will be no nation. You should be proud of you.
no matter where you are, no matter what you do. It doesn't matter even the job you do, because you are not the job that you do.
Yes,
you
so.
are who you are,
Oh, yes.
and you are a strong woman. Let's stand together. Let's fight for all women, small girls, teenagers, and old.
Women.
We are all one.
Yes, so.
Thank you so much.
Thank you so much. I know you can go on and on and on, but we have to move on the item. So next, ladies, are we ready to move our bodies more?